I have a lot of love for rural Oregon and rural communities. Eastern Oregon and Baker County is a great place to live. It's got a lot of natural beauty. I think everybody that lives out here has to love the outdoors. It's just impossible not to find something you enjoy doing outside in this area. And so when I'm not at work, not in the hospital or the clinic, I'm spending my time with my family outside. Practicing medicine out here, I think is just extraordinarily meaningful. The community itself, community of patients that I get to care for are very appreciative, wonderful people. I feel every day that I make a difference. I get to be a full spectrum primary care doctor. I work in the hospital, I work in the clinic. I'm the medical director for a clinic 60 miles outside of Baker City, all of which are really fun, interesting, stimulating parts of my work.
When you think about living on the coast, especially if you think about the Pacific Northwest, you kind of hear horror stories of wind and cold and rain. The truth is that about 8 months out of the year, it is a solid 70 degrees and sunny and just beautiful.
I get to do a lot more than I think you do in a city. So it's allowed me to develop my skills to a level beyond, honestly, what I even thought, I ever thought I would. I get to do everything. So I see newborns, I see kids of all ages, I see a lot of women's health. I do geriatrics and prenatal care. So I get to do a lot, and I do a lot of procedures. You do make more money working rurally. There's a lot more incentives, and pay tends to be higher when you work rurally compared to urban settings. If you like the outdoors and you like flexibility, then rural is the way to go. So we love it here. It's probably one of the best places to live ever.
The opportunities are so amazing here because you really can make a difference in people's lives. We're not a number here. The chances are very good that you would see a patient in clinic or perform surgery on a patient to see them in one of the local grocery stores days or weeks later. It is a very close-knit, caring community.
Roseburg is kind of just that small town, not so small that, we have a lot of resources and things available in the community, yet small enough that you do know a lot of the people in the community. Geographically, our location is really ideal. An hour from the coast, an hour from the mountains, an hour from a larger city like Eugene or Medford, just really makes it a nice fit. Lots of trails. There are smaller lakes, people who enjoy kayaking and paddleboarding. There's a lot of those activities to do. We now have a lot of vineyards around Douglas County as well. I do feel like I'm able to get a variety of patients in my clinic, from newborns up to 20-year-olds, a pretty good variety. Roseburg is becoming more diverse ethnically as well, and so we are seeing a larger variety of just patients and population in our community. I think the benefit is that you really get to know the community. I know other providers in the community. I know the systems and those resources, and I'm able to kind of link my families that need those resources together, versus in a larger city may have more options and more resources, but I wouldn't really personally know any of those people at those agencies. Whereas here locally, I know people that work, I know the early intervention team, and so when I'm referring a family to early intervention, I can tell them a little bit about what they're going to expect when they meet that team. I would not have interest in practicing in a large city. I think it would really change that patient's interaction for me. Definitely the rural setting meets my personal needs as well as my professional needs is what I'm looking for in an employer and just a lifestyle.
I feel like you can make a little bit more of an impact doing the same thing in a smaller community. It's critical that we continue to recruit providers here because these people need it.
I think, and I've heard this from other rural doctors everywhere, just that, we're always recruiting. So we are always looking.